Mr. Jones?
Hi.
Hi, I'm Susan Hellier. I'm the nurse practitioner here today. Let me just wash my hands. All right. So I understand you're not feeling well today. What brings you to the emergency department?
Well, I'm sick. I have a sore throat and I've been feeling poorly for about the last 3 days.
All right. So it's been going on 3 days?
Yeah, I've been pretty sick.
Okay. When does it hurt? When does your throat hurt?
It hurts when I swallow.
All right. Now, do you have any headache with that? Nausea, vomiting, diarrhea?
I have a headache, but I haven't vomited.
Okay. Do you feel like you've had a fever?
Yeah, I have.
Did someone check it at home, or you just felt like you did?
No, it's just a lot of chills, and, you know.
All right. Headache, chills, sort of. Do you have any cold symptoms, like runny nose, cough?
Yeah, my nose has been running, and I've
Sneezing?
been coughing.
Okay. All right. Any abdominal pain?
No.
All right. So aches and pains generally all over?
Yes, yes.
All right. Is anyone else sick at home?
You know what? My daughter had strep throat just a week and a half ago, and I'm kind of worried that that's what I got.
Oh, okay. Now, how old are you?
I'm 49.
49. Are you allergic to anything? Medications particularly?
I'm allergic to penicillin.
What happens when you take that?
It's a serious reaction. My tongue swells and difficulty breathing.
Okay, we won't give you any of that then. As far as past medical history, is there anything I need to know? Any significant medical problems?
No.
No diabetes, high blood pressure, strokes, cancer? You never had anything like that?
No.
Have you ever been in the hospital?
I had a sinus surgery years ago, but you know what? They didn't keep me. They just did it.
So that's the only surgery you've ever had?
Yes.
All right. And in your family, is there anything significant that runs in your family I need to know? Diabetes, cancer, anything like that?
Well,
high blood pressure, heart disease?
My father died of cancer, lung cancer, and my mother had hypertension and diabetes.
All righty. Now, as far as social issues, do you smoke?
No, I do not.
Do you drink alcohol?
Occasionally, rarely.
Social, that's not a problem for you?
No.
Drugs other than prescribed by a doctor?
No.
All right. Okay. Well, why don't we take a minute to examine you? I see the nurse has got your vital signs. Your blood pressure is fine. You do have a little bit of a temperature. It's 100.8.
Okay.
And your heart rate's about 102. So we'll check into all that, okay?
Okay.
Why don't you pop up here in bed so I can get at you a little better?
Okay.
Does it hurt when you move your neck?
Yeah, it's kind of sore.
It's stiff or sore?
Sore.
Okay. Let me undo your gown. Sit up for me. I'm going to look in your ears and then your throat. I see some fluid behind your ears. I'm going to take a moment. Can you take your glasses off?
Sure.
I'm going to take a moment to look up your nose. I'm going to look in your throat, please. Say ah. Oh, that does look reddened.
Feels red.
Do it again. Yeah, okay. Any lumps or bumps anywhere?
No, no.
Just checking your lymph nodes. Take a minute to listen to your heart and your lungs. Do you have a rash anywhere?
No rash.
Okay, I'm just going to take a look for that one before I'm done here. take a deep breath and cough. And you said you had a cough? Are you
Yes,
bringing
ma'am.
anything up with it?
No.
Deep breathe. Alright, well your lungs sound really clear. I need you to lay back so I can check your belly. No pain in your belly?
No.
And you said you were able to eat and drink?
Well, I've been a little nauseated, but yes, I've been eating and drinking.
Your bowels and bladder okay?
Yeah.
Okay, I'm just going to take a special moment here to feel for your spleen. Take a deep breath and let it out. Okay, well that all appears okay. So no rashes anywhere?
No.
Alright. And the headache's been gradual over the past several days related to your illness? It didn't just come on suddenly or anything like that?
Yeah, it's kind of there, and I'll take some Tylenol and it goes away.
Alright. Well, I'll tell you, all in all, your exam's pretty benign. Alright?
Okay.
Probably what you have is some type of pharyngitis. It may be bacterial pharyngitis like your daughter had, strep throat, and if that's the case, we need to give you an antibiotic. I'm going to send the nurse in to do a rapid strep test, and she'll swab the back of your throat. We'll have that that's a pretty quick test. We'll have that. If you do have that strep throat, we're going to give you an antibiotic. But since you're allergic to penicillin, we'll have to choose something like Zithromax. I want you to finish the antibiotic. You can continue to take Tylenol and plenty of fluids and rest. We're going to also send the nurse in to get some blood work looking for mononucleosis. If you would have mononucleosis, we're going to refer you back to your primary care physician because there's no antibiotic for that. Right? And you'll continue to take Tylenol. If both of those things are negative, we're just simply going to call it a viral pharyngitis, kind of a non-specific, kind of a cold. You should feel better if we put you on antibiotic at strep, or even if it's just a virus, you should feel better in several days. If you don't feel better, you need to come back and see us. If you can't eat or drink, or you start running a high temperature, those are all signs or symptoms that we need to see you back.
Okay.
I think that's it. Do you have any questions?
No. Thanks.
Okay, well the nurse will be in a few minutes to get those few tests, okay?
Okay.
Thank you. Let me wash my hands again.
Oh, I hope you have a good day.
Thank you.